All right, let's talk about heart attacks. So, what do we do for having a heart attack? How do we know if we're having a heart attack? And what's going to happen if we have a heart attack? Let me tell you what not to do. Yeah, don't do this. If you're having chest pain, don't sit in the tub and film yourself. That's a good way to die. So, let's review some of the symptoms of a heart attack. Obviously, chest pain that's either substernal, which is right in this area, or off a little bit to the left where your heart is actually located. And a lot of patients may describe that it feels like a pressure type, squeezing, even vice grip type pain. Some people even say that it feels like an elephant sitting on their chest. It's also very common to have some associated symptoms with the chest pain. Now, you can have shortness of breath. You can have pain that goes up the left side of your jaw, down the left side of your arm. You can have nausea. You can have vomiting. You can even have stomach pain and back pain. Sometimes what I see is a case like this. Patient may have had some chest pain maybe a couple weeks ago, lasted a couple minutes, wasn't that severe, then went away on its own. Then maybe 4 or 5 days later, came on again, lasted a little bit longer. It was a little bit more severe, but it went away. Then it came back a little bit quicker, lasted a little bit longer. It was a little bit more severe, and then it went away. This is classic for something that's called stuttering chest pain. If you have stuttering chest pain, you better get to the emergency room quickly. This is an ominous sign. And it's absolutely true that women can have different symptoms. Sometimes they have no symptoms. Sometimes they may have some abdominal pain, some nausea, maybe some vomiting. They may not present classically. Another subset of patients who sometimes don't present classically with the substernal chest pain and some of the other very common associated symptoms are diabetics. Or if they do have symptoms, they may be somewhat attenuated. They may have a little bit of fatigue. They may have a little bit of nausea, and they could be having a full-blown heart attack, also known as a myocardial infarction. Now, usually a heart attack is going to involve a rupture of a plaque. This is called an atherosclerotic plaque. At the center of the plaque is a lipid core. Surrounding the lipid core is a fibrous cap. Sometimes there's a split in the cap, and the lipid core is exposed. Now, what this brings on is a clotting cascade. Sometimes this clot will be occlusive, which means it will totally clog or block the artery, and everything downstream is going to be affected. So if you're lucky enough, this clot's going to be non-occlusive, which means it does not completely clog or clot the artery. Because if we have a complete occlusion or a complete blockage of the artery, everything downstream of that artery is not going to receive blood, i.e. oxygen. No oxygen equals death of tissue. There is an adage that's used when someone is having a heart attack, and that is time is tissue. Basically, you want to get reperfused, or you want to get that artery opened up as quickly as possible. The longer you wait, the more tissue is going to die. If you're having a heart attack, first thing you need to do is you need to call 911 now. There's only 1 or 2 instances I can think of where you would not do this. An exception may be, let's say that you're out in the boonies, you're miles away from any ER or hospital, you're alone, you have no cell reception, but you do have a car. Obviously, in this scenario, you're going to want to get in your car, try and make it to the emergency room or the hospital as quickly as you can. That's basically your only option here. After doing this, you're going to want to take 325 milligrams of aspirin. You're going to want to pop it in your mouth and chew it. What the aspirin does is it's an antiplatelet, so it's going to help retard some of that clot formation. That's exactly what you want. You want to limit as much clot formation as possible. Makes sense, right? Next, if you're on blood pressure medicine and you haven't taken it yet for the day, go ahead and take it. Okay, now don't forget, if you've got nitroglycerin on hand, say you have a history of having angina, you have coronary artery disease, go ahead and start taking it as directed. Pop one under your tongue, then take one every 5 minutes, times 3 if needed. And if it were me and the EMS is coming, I'm going to try and hunker down kind of close to where they're going to be coming in. I'm not going to block the entrance, obviously, but I like to be kind of close so when they open the door, there I am right there. The next thing, I'm going to keep that door unlocked. I don't want them to have to bust it down if I'm completely incapacitated. And the next thing, if I've got tight clothes, which at my age I should not be wearing tight clothes, I'm going to loosen them up or take them off. If I have a tie, definitely going to take that off. If I've got a belt, that thing's coming off too. Next thing you want to do is you want to try and stay calm. And this is going to be obviously easier said than done, but you don't want to be running around from room to room. trying to do this, trying to do that. You don't want to put your body or your heart under a whole lot of physiological stress. You already have a clot. It's already under a boatload of stress. Don't stress it anymore. Now, once EMS gets there are a couple things that are going to happen just automatically. Number one, they're going to want to do an EKG as soon as possible. They want to see, do you have changes on your EKG which are consistent with someone who's having a heart attack? Next, they're going to put an oxygen mask on you, bump it up to a couple liters per minute, make sure that you're getting enough oxygen. Then you're probably going to get a nitroglycerin patch to help open up your coronary arteries so that your heart can receive as much blood flow as possible. And then EMS is going to want to know, what is your past medical history? Do you have a history of heart disease? Do you have hypertension? Do you have a history of anything that could predispose you to having a heart attack? Do you smoke? Do you have a family history of having heart disease? Do you have uncontrolled high blood pressure? Do you have uncontrolled cholesterol? Do you have diabetes that's uncontrolled? All of those are going to be risk factors for having a heart attack. The next thing they're going to do is something called an HPI. So it's a history of present illness. Basically, what is going on? What happened? What are you experiencing? Now, another thing they're going to do is they're going to check your blood. What they are looking for specifically is an elevation of something called cardiac enzymes. So if your heart has suffered some damage, it will leak enzymes into the bloodstream. And what happens is they will check these cardiac enzymes serially. So you'll get these checked about 3 times over about 6 hours or so. Now, aside from getting that initial EKG that you got from EMS upon arrival, you're also going to get serial EKGs once you get to the ER. And then also, if you are admitted, you're going to be getting several EKGs during your stay. They want to see if there are any changes. Obviously, they want to see, do you initially have any changes on your EKG? And if not, do you have subsequent changes? This is important. So I have brought you from initially having chest pain to calling EMS to getting transported to the emergency room to being placed into the hospital. So let's say you're not having a heart attack. So what else could it be? Well, that list is pretty long, and it includes things like acid reflux, you can have anxiety, you can have something called costochondritis, which is actually very common, and that's inflammation of the cartilage in between your rib cage that can masquerade as feeling as though you're having a heart attack. And as far as treatment, this may be a little bit beyond the scope of this video, but a number of factors will come into play that determines what the next step is in your treatment plan. These include, what are the results of your EKG? What are the results of your cardiac enzymes? And what about the chest pain? Did it resolve, or are you still having chest pain, or is it worse? Usually what it comes down to is it's going to be medical management, i.e. putting the patient on the appropriate medications versus revascularization. So do we go in there and do something like a balloon angioplasty or even place a stent so that we can revascularize that artery? Or in severe cases, coronary artery bypass graft. So without getting too deeply into the treatment, that's kind of how it plays out. Either it's medical management or revascularization. So the take-home message is, if you're having chest pain, seek help immediately. You don't know what it is. It may be something benign, but what if it's not? What if it is the heart? Time is muscle. Let's not chance it.